I'm Jim McDermott. I practiced psychiatry in Seattle for 20 years, then I went with the State Department. Then I came to Washington because I wanted to see if we couldn't get national health insurance. So I lived through what happened in 93, 94. And the people who oppose what we're trying to do right now were there then. And they used fear as a way of making people say, oh, we don't want that plan. Well, Vic just told you what they got. A horrible 15 years of things going further down the drain. Now they're back upstairs talking the same way, the same fear-mongering, but I want to talk about fear for a second. We're celebrating the guys landing on the moon 40 years ago. I mean, those guys, that took courage, right? Well, 20 years ago, a guy from Seattle was flying a DC-10 across the country, and the rear engine blew out and took out all the hydraulics. So he had no way to control the plane except to accelerate the engines and slow them down and accelerate them. And you may remember the pictures of him cartwheeling a DC-10 into Sioux City, Iowa, and 185 people survived that. His name's Al Haynes. Now you'd say, gee, here's a guy who's got courage, can take anything, right? Roll forward 15 years, and his daughter has a blood disorder and needs a bone marrow transplant. You've heard that we have the best medical care in the world if you have money or plastic that will pay for it. He went to the hospital with his daughter, and they said it's going to cost you $250,000 up front. Now that's real fear. A parent looking at their child and realizing that they don't have $250,000 in their wallet that they can put up on the counter and get the bone marrow transplant that actually was done and saved her life. The way he got it was to put out a request to his fellow pilots, the people who survived the flight, and the other people at United Airlines. A gigantic bake sale. And you see these bake sales going on all over the country, in churches and in schools, where people have somebody who's very sick and they don't have the money. Now that's the fear that this bill is taking care of. We are going to give people health insurance that can never be taken away. They're guaranteed to be issued, no matter what their medical condition is. And if they get something, the insurance company can't rescind and take back the health insurance, which is what they do today. So when you listen to that fear, remember, we have nothing to fear but fear itself. We are going to pass a bill out of the Congress to take care of the American people's fear of health insecurity in this country.